Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Hamid. May I know what brings you here today? Okay. Tell me more. I'm very sorry to hear about that, Mr. Hamid, and I totally understand that how difficult situation would be for you. Is there anything else you want to add, Mr. Hamid? Okay. All right, Mr. Hamid, in order to better understand your condition, I need to ask you a few questions. Is that okay with you? All right, Mr. Hamid. So is there a ringing in both ears or just one? Okay, and is it present all the time or does it come and go? Okay, and since when you have noticed this ringing? Okay, what makes it better? And what do you think, what makes it worse? If there is any associated symptom with the ringing, like nausea, vomiting, any dizziness, any deafness. All right, Mr. Hamid, does it affect your sleep as well? Okay, and how intrusive you find the noise? If you can concentrate on your work. I'm very sorry to hear about that, Mr. Hamid. So, Mr. Hamid, does it stop doing things? Okay, if there is any previous problem. Okay, and how is hearing? Okay, it is perfectly fine. Okay, all right, Mr. Hamid, if there's any major life events recently, okay, and if there is any head injury, any injury to ear, have you noticed any ear discharge? If there is any fever, any pain in ear, have you noticed any balance problem? All right, Mr. Hamid, if you had any cold recently. All right, Mr. Hamid, in order to better understand, I need to ask you personal questions. Is that okay with you? Thanks for trusting Mr. Hamid. So, do you smoke? Do you take alcohol? Do you have high blood pressure? If you are taking any medication for that, may I know the name of that tablet? All right. Mr. Hamid, do you have high blood sugar? Okay, and how are things at home? What do you do for a living? Okay. So how are things at workplace? How about your mood? All right, Mr. Hamid. If there is any similar complaints in past, okay, have you been near some explosion at any time? Have you heard any gunshot at a near distance? Have you been hospitalized for any reason previously? All right, Mr. Hamid, if there is any similar history in any family member, and what medicine have you taken over the last 6 months? Okay, and do you have any drug allergies? All right, Mr. Hamid, what do you think is the cause of your symptoms? Okay, and are you worried about anything in particular? Okay, I'm very sorry to hear about your grandfather, Mr. Hamid, and I'll try best of my abilities to solve your problem. Is that okay with you? Thanks for trusting me, Mr. Hamid. So, Mr. Hamid, in order to reach my diagnosis, I would like to examine you. Can I? Thanks for your cooperation, Mr. Hamid. So then I'll sanitize my hands, and right, Mr. Hamid, I'll do a few tests, okay? I'll whisper in your ear, okay? And you have to repeat what I have said, okay? And I'll close your one ear, okay? So I'll whisper in each ear one by one and ask the patient to repeat what I have said. I'm pressing triggers. And then I'll perform a Venice and Weber test. So Mr. Hamid, now I'll do a test by this fork, okay? So I'll strike the turning fork with my elbow, and then I'll touch it on the mastoid process behind right ear, and then I'll ask the patient if he's sensing the vibration, and then I'll bring it anteriorly in front of same ear, and then again I'll ask patient if he can hear. If he can hear, then no need to perform Weber's, but if there is any problem or any difference in both ears, then I'll proceed for Weber test. And for Weber test, I'll hit turning fork with my elbow, and then I'll place the tip of vibrating turning fork on the vertex of patient's hand and head, and I'll ask patient if he can lateralize any vibration. If he says that he can lateralize towards one ear, then it means the problem lies with the lateralized side of ear. And then I'll check trigeminal nerve for corneal, ophthalmic, and maxillary and mandibular. So I'll touch for pain and temperature, and touch wisp of cotton to cornea, and then touch maxillary mandibular area with pen. Mr. Hamid, can you please close your eyes? Okay, and then I'll take cotton whisk and touch bilaterally regionally on the face, and then I'll ask patient if he can sense, and then ask patient to clench his teeth, and then I'll check on your reflex. Mr. Hamid, can you please look up and look down? Okay, and then I'll observe patient's expression while talking. If there is any drawing of saliva, and then I'll ask patient to raise his eyebrows, and then compare the wrinkles on both sides of forehead, and then ask patient to firmly close his eyes, and I'm going to open it to see the muscle power, and then I'll ask patient to show his teeth, and then I'll ask patient to blow out his cheeks, and I'm going to press on both sides fingers, and patient will be unable to maintain blow out check on the affected side, and then I'll ask patient to smile. All right, Mr. Hamid, you can have your seat. Thanks for your cooperation, and then I'll sanitize my hands again. So Mr. Hamid, you are experiencing some ringing noise in your both ears, probably because of damage to your ear nerves and due to loud music, which is your passion and profession. Okay, you can hear the noise while there is no external stimulus, and I assure you that this is not a serious thing. It's common and won't end up in brain cancer. If it makes sense to you, Mr. Hamid. Yes, Mr. Hamid, although the noise is distressing, but there are a number of ways to help you with this condition. Is that okay with you? Yes, Mr. Hamid. I'll suggest you to follow general rules of sleep hygiene. Okay, and your bedroom only for sleeping, no laptop, no TV. Okay, and try to avoid caffeine in the evening. All right, and do some light exercises during the day. Is it convenient for you, Mr. Hamid? And besides that, I'll suggest you to do yoga or meditation, okay, and deep breathing exercises, okay, and I'll I'll ask you to join local self-help groups for support, okay? And you will be talking to other people with tinnitus, okay? It may help you to cope with it if it makes sense to you. Mm-hmm. And along with that, Mr. Hamid, I'll refer you to the psychologist for talking therapy, okay, in the form of cognitive behavior therapy, okay, in which psychologists will try to change how you think, feel, and act. Is it convenient for you? Mm-hmm. And besides this, Mr. Hamid, and some background noise such as white noise emitters can help. Okay, and hearing aids to decrease background noise can be used as well. Okay. Mm-hmm. And besides that, I would like to review your condition in a month time or sooner if you have any new concern or new symptoms. Okay. And I'm also offering you to refer. I'm also referring you to ENT specialist for his opinion. Okay. And but there is. Mr. Hamid, if you experience sudden hearing loss, weakness of your facial muscles, okay, and you feel any spinning sensation, you get immediate medical help, okay, you can call 999, okay, and I'll suggest you not to drive to emergency department, okay. Is it convenient for you? Mm-hmm. All right, Mr. Hamid, if there is anything else you would like to discuss with me today?